Hi, everyone. I'm Raj Kumar, President and Editor-in-Chief of Devex, and delighted to be back with all of you this year for Prescription for Progress. Of course, we're not in person in San Francisco as usual, but it's still great to be with all of you virtually. And we are here to talk about the future of global health, about tech, about innovation, and where it's all headed. I can't think of a better person to have that conversation with than Vinod Khosla, our very next guest. I'm here with Vinod Khosla, someone well known to all of you for many different reasons. I'll just very briefly share a bit of your background for those who don't know you as well. I mean, Vinod is one of the founding fathers of the computer revolution, of the internet itself. You then went on from, after founding major corporations in that space, to becoming a noted venture capitalist, now with your own firm, Khosla Ventures, which is one of the most prominent in the space, and known for betting big on big ideas. You know, lots of VCs talk about betting big on big ideas, but you really think about the future. You were one of the first VCs out in front of the climate change investment landscape, green and renewable energy. You've invested in things like Impossible Foods. You were the first major investor in Impossible Foods, in QuantumScape, the battery company. You're working fusion investments right now in the energy space, so many things like that. And healthcare is one of the spaces you're very focused on the future of. So we want to talk to you today, Vinod, because at Prescription for Progress, we think a lot about where are we headed, not just next year, but really out into the future. Half the world, half the population of the world does not have access to basic medical care. As you well know, as somebody who grew up in India, you know, where do you see health technology moving, and is it moving in a way that will actually address the needs of people who desperately need healthcare today and don't have it?
Well, thank you, and it's great to have an audience like this to speak to. Where health technology goes is a function of where we decide to take it. We do have a choice. Most of what we have seen is pretty large, pretty incremental breakthroughs. But let me start by saying healthcare is better than it has ever been today, though fairly unevenly distributed across the globe. And 10 years ago, it was better than it had ever been before. So it has kept improving. But it has been improving incrementally without a radical rethink of healthcare. And we do have a choice in deciding which way we want to take it. I will give you a specific example. The single scarcest resource in healthcare is really expertise. What's expensive? It's an oncologist, it's a cardiologist, it's a primary care physician. So trained people are the rare resource. Now, at some point you get to drugs and devices and all that, but the single most expensive part, and I think the solution we have to have a vision for, is this lack of expertise globally. And we can choose to do small short-term optimizations, and a lot of what is called digital health is doing that. But they're not fundamentally changing the equation. You could put a doctor on telehealth, on a video conference call with a patient, but that's not changing the physician resource or making the physician any better. It's maybe making him a little more efficient, but there's a limit to that efficiency. If, however, we take the long view and say all of the expertise of a really great primary care physician or a really great cardiologist or oncologist needs to be available to everybody on the planet when they need it at very low to zero cost, I think that's possible, but we are not driving in that direction with sufficient vision.
And you're talking about here, Vinod, an artificial intelligence solution, right? Sort of
Right.
the idea that you could bring an oncologist to a small village because an artificial intelligence solution can do the diagnostics, do what a radiologist or oncologist would normally do. Is that your vision?
My vision is if we take the right approach, we will have artificial intelligence embody most of the knowledge we have in medicine. And it should be able to substantially outperform the median physician. Substantially. There is no question that an AI will do better than most physicians. Not every physician, but most physicians. It'll be broader, and you won't need a cardiologist to consult with you and then have an endocrinologist consult with you separately. You'll have an integrated view of the same human person, body, because the expertise is all there. Now,
And you see this, and Vinod, many people are worried that these kinds of technological shifts will only be available to the wealthiest countries, the wealthiest people within those countries. Do you see these as shifts that can come even to the lowest resource settings?
Yes, but before I get there, I want to just clarify one thing. It may be mediated by a human being, and in fact, likely will be. So today, the brain surgeon is way more valued than, say, a primary care physician. And I'm saying in this world, the primary care physician may be the most valuable person because they're integrating all this AI expertise in their interface with the payment. If we're going to have integrative medicine, not a cardiologist and an oncologist and an endocrinologist, it's going to be the primary care physician who becomes the most important physician in the world, the most valued, hopefully, integrating value from all these other tools and expert systems. To your question of affordability, I actually believe it is the only way to make healthcare accessible. Why? Because it should cost the same as a Google search.
So if you were today, Vinod, advising a health minister who might be part of the session today and listening in a low-income country, and they have to plan ahead, should they be investing more in primary care physicians or maybe even community health workers? Asha is the example in India, thinking that we're close, we're a decade away from this kind of technology being open to these kinds of settings?
Well, how far we are away is a function of us making it happen. They should not only be planning for it, but they should try and encourage it. Now, a system like that doesn't improve till it's used a lot. And so where your audience can participate is absolutely encourage the use of these technologies. If you take a simple paradigm, if such systems improve 1% a month or even 1% a quarter in their knowledge, over 10 years, they become better than most physicians. But they only do if they get a lot of usage. Today, so few people are attempting this approach that there's no simple way for the AI system to get better. So if you want that, we should be doing it today. And because early systems will be flawed, think of for those of you who are old enough, the personal computer in the 1980s. They had these funky green screens, low resolution text, looked like dots. They were very clumsy. They didn't do a lot, but every year for the last 25 years, they've gotten better. Where they're powerful than the most powerful supercomputer in the world from 20 years ago. In fact, your phone is probably more powerful than the most powerful supercomputer on the planet 20 years ago. So this doesn't happen automatically. We have to participate and improve it. And when it's not perfect, the answer isn't the system isn't perfect. The answer is we will have humans mediate this. And so for the first 3 years, for example, it might just make a primary care physician twice as productive. Now, that's a pretty reasonable thing to do. Say, let me do all the question answering, the back and forth, the dialogue between a patient and a system with an AI, but the AI never does a diagnosis, never does a prescription, but may summarize recommendations for a human physician to say, I'm going to prescribe X or Y at Z dosage. So this partnership is essential for the systems to learn from humans and develop. So in 10 years, a session like this costs pennies, not hundreds of dollars as it does in the US today. And it's well within our reach in less than 10 years to basically make free primary care physicians possible in every part. And I hope well before 10 years, the FDA would approve such an app that is certified as a primary care physician.
You think the FDA might actually certify an app as kind of equivalent to a primary care physician?
Well, if you do A/B trials, they should be able to do this. For at least half a dozen cardiac conditions, looking at an ECG, the FDA has already done it for a company like AliveCo. They've already said you can diagnose these 6 conditions that a physician might do, a cardiologist might do from an ECG. You can do this, and AliveCo offers this today. Now, I can tell you the cost of monitoring a patient in rural India with this kind of service is pretty close to zero. You know, in the US, they charge $10 a month. They have something like 130,000 subscribers of this service, who, by the way, on average do tens of ECGs a month. That wouldn't be affordable even in the US as a healthcare system. But these patients don't want to die. They monitor themselves closely and zero cost. It probably costs a penny or two to do an ECG and get it diagnosed. And that's the world I'm talking about. But we got there after we got 100 million ECGs. 100 million. Mayo Clinic doesn't have that many ECGs. And we have a lot of contextual data. So I think this is a process. It's a journey somebody in your audience needs to commit to and say, we'll walk down this. So Curai is developing the primary care service, but they don't have 1 million patients a month. And if they did, and they do, in fact, use physicians in the US because you aren't licensed to prescribe or diagnose, and they use physicians in India, and they use AI, everybody doing the most they can at the top of their license to deliver a service that costs a few dollars today to deliver as a primary care session. You know, if telemedicine is an order of magnitude cheaper than a regular visit, which may be $200-300, and telemedicine is probably $40 or $50, this kind of a service is 10 times cheaper than telemedicine over chat, and substantially better. And let me tell you why it's better. Because in telemedicine, you call teledoc, you do a session with a physician, call them back again 2 weeks later, you're not going to get the same physician. That person won't have a record of the actual conversation they had with the patient. In a chat conversation, AI will summarize the last session to the AI, so that there's full context. So the old notion of a family physician who knows your history and continuity of care is only possible in this kind of an environment.
Well, that was Vinod Khosla, who is, of course, the founder of Khosla Ventures and one of the founding fathers of the computer revolution and the internet itself. Really an amazing future thinker and somebody who invests big behind those ideas. Fantastic and interesting discussion, I think, in many ways, pulling on this thread of the future of healthcare in low and middle income countries and how it may be driven by AI. So stay tuned for more on that theme in our coverage and at this conference. Thanks for being a part of Prescription for Progress, and stay with us.